Colon cancer screening is extremely important. So unlike some other screening tests, this one actually prevents cancer. So the important reason to do colon cancer screening is that we can find lesions before they become problematic and remove them. So when we're doing a colonoscopy, what we're looking for are polyps, which are raised or flat lesions in the colon that look abnormal, and we're able to actually remove them during the colonoscopy. Not all of these precancerous or adenomatous polyps will become cancer, though a vast majority of them have the ability to, and so regardless, it's very important to get them out before they become an issue. We know that adenoma detection rates, or the rate in which we find polyps in people, is somewhere between 30 and 40% for men and 20 to 30% for women. So generally speaking, a good percentage of people will have polyps on their exam, and so that's why we stress the importance of getting your colonoscopy during the recommended intervals. Generally speaking, all guidelines recommend that colon cancer screening begin at age 50, and that's for the average risk person. If you have a family history of colon cancer or other genetic risk factors that you should discuss with your physician, screening may start earlier than age 50, but for the general population, colon cancer screening begins at age 50, and then the interval to which you continue to have colonoscopies after that will determine what's found during your colonoscopy. So if you have no polyps, then the interval is every 10 years. If you have polyps, it may be sooner than that, something like 3 to 5, depending on what's found. We know that screening generally starts around age 50, as I mentioned. However, when does screening stop, I think, is a little bit more of a complicated issue. Most guidelines recommend that between ages 75 and 85, it's on an individual patient basis, meaning if you are someone who has had multiple polyps removed in the past, it may be worth continuing screening in that 10-year period. So bowel preparation is actually the most important part of the exam, because how clean your colon is on the inside is what allows us to actually see and remove polyps. And polyps can actually be small or flat and hard to detect if the colon itself isn't very clean. Before a colonoscopy happens, what you'll be doing is actually cleaning out your bowel with a bowel prep. That's a laxative that helps remove all the stool from your colon, so that when we actually go in with the colonoscopy, we're able to see really well and find all the polyps in there. So we generally recommend going on a low fiber diet the week before, meaning not a lot of raw vegetables or high fiber foods, because those can actually hang around the colon for quite a while and make cleaning of your colon a little bit more difficult. And so actually starting a week before by altering your diet a bit can make the prep much more effective when you actually start to drink the laxative the day before. When you actually come in for the procedure, you have an IV placed in your arm and you're given sedation that makes you sleepy and comfortable. We generally use something called IV conscious sedation. So you're not completely asleep like you would be for a surgery, for example, but you're very comfortable and almost in a twilight state. And then we take a long thin camera that has the light on the end of it. We actually go in through the rectum and we go all the way around the colon. On the way back is actually when we do all the inspection. So we put in air and water into the colon so that we can distend it and see really well. Colonoscopies generally last about 30 to 40 minutes, depending on what we have to do while we're inside, meaning how many polyps we have to remove and how clean the colon is. So right now there is no proven therapy or proven intervention to prevent polyps. We are predisposed to polyps through mutations that are sporadic, and so there's not necessarily anything one person can do to prevent polyps. That being said, getting screening colonoscopies can certainly prevent cancers from happening from polyps.